My name is Stephanie. I work at UNC Rex Hospital, and I'm an occupational therapist. I'm here today to teach you how to use special equipment to help get your pants on and off after you've had something like a total hip replacement where you're not allowed to bend past 90 degrees, or you've had back problems and you're unable to bend over, or any other reason that it's difficult to get your pants on and off your feet. This tool and this tool are things that we can teach you how to use so that it's easier for you. This is a reacher, or a grabber, people call it, and just a basic tutorial here is there's a trigger and there's a grip. If you pinch, it pinches. When you release, it releases, and it has a piece here that you can push your socks off and things like that, and we'll teach you that later. This is called a dressing stick. This also helps you put your pants on over your feet and off without bending past 90 degrees. We're going to start by using the reacher to teach you how to put pants on. We're going to use a pair of shorts to mimic underpants. Now, whichever leg is the affected leg, whether it's a surgery leg or a weaker leg, that's the leg that you want to put on first and off last. That's the general rule. If you do have hip precautions, it is definitely something that you want to continue to do through the duration of the precautions. So let's just say that I've had surgery on my right hip and my right leg is the weakest. I'm going to take my underpants and gather the leg so that it makes a hole. I'm going to open the reacher and just put it through and grip it. I'm going to extend my arm all the way down, put my toe out, and I'm going to search for where the reacher goes through the leg with my toe and use my hand to wiggle it over. And see how easy that is? It pulls right up, and you pull it up to where you can reach it at your knee. You don't want to, if you've had hip precautions, reach past your knee. Here I can get it to my knee very easily. Bring it back around, do the same thing with the other leg. Put it straight through. I need to push it down. All I need to do is put my toe through and pull it up. Okay? Once it's up and I can reach it past my knee, or at my knee, should I say, I'm going to pull it up to past my knees as high up as I can on my thighs. That waistband, especially if it's elastic, will hopefully stay before I have to stand and pull them up. We have two options here. We can go ahead and pull our underpants up now, or we can wait and put your pants on, and then you only have to stand up once to pull everything up. For this tutorial, we're going to do them separately. I'm going to bring my walker around, scoot to the edge, put my affected leg out if I have a hip replacement. That opens the angle so you're not bending past 90 degrees. I'm going to pull this waistband up as high as I can so it stays, and then I'm not going to touch it again until after I have my balance. One hand on the walker, one hand to push up. Once you're standing, get your balance, put your leg underneath you. Once you have your balance, then you can let go and pull up. Now you're going to be a little more swollen sometimes if you've had surgery, and then you pull up. The other option is for you to have one hand to pull up if you don't feel steady, to pull up, and then switch hands. Okay, once they're up, you're good to go. Now what I'm going to do is teach you how to take them off. We're going to push them down, whether it's one hand at a time or both hands, until I can just touch them with my fingertips. I'm going to put that leg out if it's a hip replacement precaution, and I'm going to reach back and sit. Once I have the pants to my knees and I'm sitting nice and sturdy, I can use this to push it down all the way to my ankles. I'm going to move the walker out of the way so that you can see this. I'm going to take the reacher, and remember, the surgery leg goes on first, off last, or the weaker leg goes on first and off last. We're going to take this piece, push it down the back of the pants leg, pinch the material, and push it off the back of my heel. And then we have the other leg open and free, where I do the same thing. Grab the back of the pants leg inside, grip it, straighten my knee, and push it off. And there you have it. The next thing we can do is the long pants. I'm not going to pull those up, but I'm going to show you that it's a little bit different than the underpants because it has more material. So you again want elastic waistband and something a little stretchy at first. Makes it a lot easier. You can take that right leg and just put your hand through it and gather all the material. Same technique. Oops, I moved the reacher too far away from me. You're going to grab right through the pants leg, grip it, and bring it down, and again put your toe where the reacher goes through. Now I will tell you that for long pants, if you can't get your toe all the way through the hole, that's okay. You can let go once your foot goes in and grab the waistband and pull it up. That's a lot easier. You don't have to worry about it. Sometimes it will get stuck. All you have to do is undo it with your hand, reach down, pull it up. And then you do the same thing with the other leg, you gather it up. Now the only other tip that I have with this technique is if it's your surgery leg and you put it through and you find that you're starting to try to lift your leg to put it through, that means that this arm or the arm that you're holding the reacher is not extended completely. You're not using the length. So if I put my arm completely down, I don't have to lift my leg. And then you'll put it on just like we showed you with the underpants. Once you take them off, I'll show you that as well. You're going to grab this again, grab the back of the pants leg in the bulk of it and push it right off the heel. And there you have it. Easy peasy. Now we're going to show you a little bit different with the dressing stick. This does not grip, but it does have hooks on it. So all you would need to do in this situation is put it through and just have the hook. Now you cannot pinch it. I'll show you. I can take the hook up, put it on the hook, and put it over my toe and pull up. Now and then pull it up like so, okay? And it's the same technique. It's a little bit harder to get it out sometimes, but just be patient. Everything that you do is going to be a little slower than normal. Take your time and you will do just fine. And the more you do it, the easier it will get. You just have to work it through and see, I have to be patient and pull it over my toe. All right. And there you have it. And then you would pull it up like I showed you the first time. And that's the dressing stick. Thank you so much for joining me today. I hope this helps so that you can understand how to safely get dressed and be a lot more independent. If you ever have any questions, just track down your nearest occupational therapist. They'll always be willing to help you. Here at Rex Hospital, we have several. We'd be very happy to help you with those kinds of questions. I hope that this keeps you independent and safe. Have a great day.